Okay, hello. Just so you know, I was trying to start this for like the last couple minutes, but it wouldn't go. So here we are. But this is Monday Movement, and I don't know if I'm going to be doing this every single Monday. I don't want to put that pressure on myself, but if you see a post that I'm going to do it, look out for it. That's all I have to say. So I've been sitting all day, and I just wanted to show you guys a few stretches and exercises that I'm incorporating after work today. So I have another call that I have to get on, so this is going to be kind of quick. So if you're watching, comment below so I know you're here. All right, so I'm just first going to start out with some pelvic tilts, posterior, anterior pelvic tilts. So these are called your cat-cows. Cat is when you're arching your back, cow is when you drop down. So cat is a posterior pelvic tilt, and cow is an anterior pelvic tilt. Just going to stretch here. So this Monday Movement is also focused on hip mobility. If you follow me on Instagram, which please follow me, that'd be awesome, I appreciate it. I posted a reel today about hip internal rotation, so I'm just gonna jump into it here. So that's something I've been really struggling with and trying to focus on, so I wanted to just kind of break it down a little bit to see if anybody else can do this, or maybe you have great hip internal rotation, and if that's the case, then I'm jealous. So we're just in, you've seen this before, 90-90 stretching. You've seen it all over Instagram. This is a really good one for the hips, but I'm focusing on this back leg here. So I'm just gonna bring it up, bringing that hip socket into internal rotation. And if you are in this group and you wanna see when I'm posting a video like this, if you turn your notifications on, you'll be notified. Or maybe you'll just, I don't know, depends on what your phone setting is. Like sometimes I just turn notifications off, but okay, so I lost count. Let's switch sides then. And then I'm just gonna go forward a little bit too. Just a little stretch. So I'm working on my right leg now, getting that internal rotation here. So I'm using my hand to help a little bit, just to, it's called like active assist, just to kind of, because it's weak and tight in there, so it's not strong enough to lift up yet too much. But it feels really good. I've been sitting all day, so doing some training. Okay, so, and you can also see this one, I didn't put this one in my reel today, but this is really going just kind of like windshield washering. Ooh, not enough space right here. So windshield washer, or just bringing your hips over. Windshield washer, windshield wiper. Wiper. Ah, this feels good. Okay, another one you can try. So we're working on hip internal rotation, but if your internal rotation is tight or limited, more than likely you are also lacking hip extension as well. And so another one you can do is like this. So these are all, this is pretty, you know, advanced. If you're early postpartum, I probably wouldn't recommend doing these yet, but if you're like me and you're not, or your kids are grown, or, you know, try it out. Let's see. Okay, so I just put a pillow down for my knee, and so I just have my knee bent. If you are a little bit older, have bad knees, you can modify this by laying on your side and just working on getting some hip extension here. So trying to make sure your pelvis is neutral and you're flexing your knee and you're stretching your quad, but you're also getting a good psoas stretch as well. So I was here, but the big thing is that, especially with women, if we're falling into that anterior pelvic tilt, that the extension in your hip is coming from your back. So you need to stabilize your pelvis and then get that extension. So like women who are, you know, doing all the butt kicks and stuff, like, make sure that extension in your hip coming backwards is not coming from your back, but it's actually coming. Let me see if I can even do this in this position. So I am like neutral here, and if I'm just, actually this would be a good one for early postpartum. Alyssa, keeping your pelvis neutral, so more a little posterior pelvic tilt, but you also want to make sure that you're not gripping your booty, because that's gonna, you probably already have some pain if you're postpartum, but you're just compensating instead of using your abs. So that's something that I struggle with. I have to focus on my low abs. That's gonna be stabilizing my core. Look, I'm kind of, it's hard to talk and do all this. I'm out of breath a little bit. Okay, so neutral pelvis, and you're just, I don't know if you can see me. You're literally, you're in tall kneeling like this. You can hold on to something if you need to, but there's your extension there. And that feels really good. And so I'm really focusing on my whole glute, but I'm also focused on my core and my pelvis. So you don't want to keep that, like, pretend there's like a little teacup on your pubic bone. And so that's what's making you stable. Okay, so that's another one. But back to this couch stretch. I learned this from a PT named Kelly Starrett. So, oh, I gotta switch knees. Do this one next. Okay, fuck. Alright, so here we are. So same thing, like I was saying, got off on a tangent. While you're doing this, my knee is bent, my shin is up on the couch. Just feeling this good stretch. And the more you can kind of pelvic tilt your hips back a little bit, you feel that good stretch in through here. And just breathe. Okay. Sayonara.